Hey guys, Preston Collins, physical therapist here, and I want to talk to you today about a controversial topic, which is why I do not think you should be doing leg lifts after a hip replacement, and instead what you can try to still get the same effect. Let's go. Okay, so the reason I do not like the leg lift exercise after hip replacement is pretty simple. Most people before this surgery are having pain in one distinct location, and that location is the groin. Now, can people still have things going down the side of the leg, the butt, the back of the leg? Sure, but the common denominator usually is some pain in the groin. If you think of that leg lift exercise that pretty much everyone has seen, and if you haven't, here's what it looks like. What most people see with this is that when you lay on your back and you go to lift that leg up towards the ceiling, the primary muscle that you are working is your hip flexor that lies right on top of the new ball and socket joint of the hip. That muscle, as it shortens, is what helps bring your leg up towards the ceiling. Pretty much everyone that tries this exercise right after surgery, even in the first week or two, finds that it's either very, very hard, it's very painful, or it's even near impossible, depending on where they are at in their recovery. I think one of the biggest things we never talk about with this exercise in particular is that most people think they can't do this because they aren't strong enough. And while your strength does play a role, it's not the only thing that plays a role. We have to think that after surgery, when you have swelling, your leg is heavier than it normally is, which means it's going to be harder to lift in general anyways. And the second thing with that is that when you get done with that surgery, you have what we call pain inhibition, which means that your body gets very smart and it realizes that if it lets you do certain things or contract certain muscles, it's going to make your pain go up. And so as a protective mechanism, your body essentially tells those muscle groups and those systems, hey, calm it down, because if I let you do it, it's going to hurt. So one little modification we can make instead of having you do that leg lift exercise like that is going to be really simple and a little bit more functional from my standpoint. If you stand at a counter with your hands for support, or you stand at your walker that you're given after surgery, all you need to try to do is take your surgery leg and take your knee and bring it up towards your hands. So if you're standing at a counter, this works out really nice because your goal can be to bring your knee to the underside of the counter. You're just lifting as far as you can comfortably and back down. You obviously would not want to go past 90 degrees, which is going to be a straight across thigh, unless your surgeon has told you otherwise. But my guess is for most of you starting out, you're not going to be getting close to 90 anyways. It's going to be a lot less than that in terms of an angle. That's just fine. We have to remember that the reason you're doing this is to try to get that muscle on the front, that hip flexor, to work a little bit more, but more than anything, it's to keep the irritation levels down. If we let that irritation just rise and rise and rise with more exercises and more movement, what tends to happen is it works against us, right? The body pushes back again and it drives our pain levels up, our irritation levels up, and it drives our activity down. We don't want to do that. So what I really like about this exercise in particular is that when we go to lift it, we've taken out that long leg, right? So a very nice analogy I like to use is that if I'm going to hold a weight in my hands, and let's say it's 20 pounds, if I hold a 20-pound weight, it's going to feel much different if I hold it way out here versus if I hold it right in tight to the body. And the reason that is because way out here, my shoulder muscles are having to do a lot more work to hold that against gravity. That's a lot longer of a lever that it has to hold against and not let it drop. The same is true with your hip. If we put your hip way out here with your foot and your knee extended, to hold that weight of your leg is a lot of pressure on that hip joint. We don't want that much pressure. That's not the goal. The goal is not the pressure of the joint. The goal is getting the muscle on the front to do the lift or to do the work. So a very simple modification like we talked about is let's shorten that lever up. Let's have you just do a little tap or a lift of that knee where now you're still working the same muscle. You're still working the hip flexor, but we're getting all that load that was on your hip previously out of the equation. So you should be a little more successful with it, you should have a lot less pain with it, and that should be something more functional that you can try that's preparing you for things like stairs, going up and down curbs, getting in and out of the car, on and off the bed, and that sort of thing. If you are in the initial phase of, I would even say the first 2 weeks after surgery, please don't feel bad if you are still needing help getting on and off the bed. I think that's one of the reasons this exercise is prescribed most commonly, is to help people with that active lift of up and down. But in those first 1 or 2 weeks, you want to use a belt. You want to use a leash, a strap. I have a device I really like that I'll leave in the description below from Amazon that I really like. It's very cheap, but it does the job, and it lets you feel a little more independent instead of needing someone there to help you with that up and down lift. But don't feel bad about that. That's something that pretty much everyone either should or does use in that early phase, but that's just because in the early phase we're trying to compensate for a lot of that pain and irritation that you have. The goal right then is not just to cram that strength back to your hip flexor in that long leg position. Please don't make that the goal, because I think you'll be very surprised if you do about how much longer that actually takes for your recovery to take place. The other seed I want to plant for you with this topic is such that if we talked initially about how much pain most people have in the groin area, it's kind of ironic to me that we would give folks an exercise right afterwards. And you see this on every exercise sheet that's on the internet. Most therapy offices or doctor's offices will give the leg lift exercise. But it's really ironic to me that we do, because we are now putting all of that strain and pressure across the same tissues and the same nerve endings that led most people to the surgery in the first place. Right? So that referred pain was going to the groin, and all the tissue there was working overtime and feeling that irritation. The last thing we want to do is overload that same tissue in that long leg position again. So I hope this was beneficial to talk about this. Please don't feel bad if you either can't do the leg lift or you're really struggling with pain levels from it. You are not crazy. Unfortunately, that's just the nature of that exercise. And if nothing else today, what we've done is we've shown you a different exercise you can use instead that you should be more successful with, have a better return to function, and it be just more practical for your daily life, instead of something that you're working on that really has no bearing in what we do every day anyways. If this resonated with you or you agree, disagree, please leave a comment below. I would love to hear from you. And last but not least, please hit that subscribe button and the like button. I'm really trying to get this out to as many people as I can following hip replacement. So if this was beneficial, please help me out and be looking for our other videos to come. Thanks so much. Talk to you soon.